Welcome to Shreveport-Bossier Local Lens, the podcast dedicated to sharing the stories of the people making a difference in the Shreveport-Bossier community. Hosted by Jeremy Sutton, each episode dives deep into inspiring conversations with local leaders, creators, and change makers who bring unique perspectives and positive impact to our area. Hey everybody, welcome to the podcast today. I am with Lakehaven vet, Dr. Meredith Berry, and we're going to be talking about her mobile business and what she does here for the community. So Meredith, thanks for joining me.
Thank you for having me.
Yeah, awesome. Just kind of tell us your history, your journey into being a vet.
Yeah, so I've been a veterinarian for 11 years. So I graduated from LSU vet school. So I actually worked in Texas for about 8-9 years as an associate veterinarian. And then we moved back here. So I'm originally from North Shreveport. So we moved back here in 2022, me and my husband, he's from Bossier, to be closer to family.
Yeah.
With we have a 5-year-old and just be closer to family and all that. And originally when I moved back, I kind of did relief or travel work. So I kind of like went around and visited all the clinics and worked there and kind of, got my name out there. And, I just got to the point where I was like, I really want to have my own practice and house calls. I would do house calls when I worked in Texas, like a lot of vet clinics, used to before COVID, before things got crazy and, just so busy. It used to be pretty common for vets to go out, during the day and, go run and do a house call and then come back. Nowadays, it's really hard for veterinarians in a regular, brick and mortar clinic to get out for, 1 hour, 2 hour to go see a pet. So house call veterinarian mobile practices are becoming pretty popular. So I really enjoy it just because I get to kind of see a different side to things. I really get to know, the owners and like the pet's lifestyle, their environment, all of those things. You get a better idea of, what's going on and how to make a good treatment plan for these pets.
Yeah. So you're like Benton Bossier's Dr.
Benton.
Pole, right?
Yeah. I do not do large animals. Unfortunately, people ask me about that a lot. Just dogs and cats. That's enough for me. That's what I've, been doing since I've been a veterinarian. So lots of dogs and cats. No no exotics, but dogs and cats, and that just keeps me plenty busy.
Oh, I'm sure.
Yeah. Yeah.
So what area do you serve?
So I try to stay in Benton, North Bossier, just location-wise, that's a little bit easier for me to travel to. And I do want to be accessible to people if something comes up or if I need to like drop something off, I can do that pretty easily. So I do serve Houghton as well. I do go out to Houghton to have some clients out there. So
yeah. Well, you talk about mobile vets are kind of becoming more of a thing. Same thing for physical therapists. And that's what I do as mobile PT. Because, one, there's no overhead really.
Right.
Just my truck and the things I carry.
Yeah.
But two, we can bring a better service, I feel like, by going to someone's house. Talk about what went into kind of your thought process of being brick and mortar versus mobile.
Yeah, I mean, I think, there are some things that, are limitations, like when you're not in an actual clinic, which if I have a local clinic in Bossier that if I do need x-rays or something like that, they're great about letting me, use an exam room. Or if, someone does live a little farther out but would still like to see me, I don't mind meeting there and, we see the pet there. But mobile, I really focus on a lot of senior pets that have mobility issues, or bigger pets that people like it's really hard to get them to the veterinarian, or cats. Cats are a market as well because cats get very stressed at the veterinarian, and a lot of cats do really good at home, and it's fun seeing cats at home. It really is. But like the senior dogs that kind of have mobility issues, people that are just busy, like it's just easier for them. I'm sure you see that too. People that work from home that can just kind of like have someone come to them and they don't have to like leave their house while they're like at home working. That's a clientele that I have as well. Then clients that are a little bit older that just have a harder time getting the pets to a clinic.
Right. Yeah. So I think that people that do mobile businesses, not saying people that have brick and mortars don't want to do this, but you tend to want to serve a little bit more and give a little bit extra.
Yeah.
Why is that important to you to serve the area and do
Yeah,
that?
it really, and like you said, like I feel, and being a veterinarian in a brick and mortar, as an associate for a long time, I've, absolutely been in general practice a long time. And you are kind of like limited with your time, like scheduling, like you get 20 minutes, like,
Mhm.
30 minutes on a good day, but you're also doing a lot of stuff in the meantime. My house calls, I'm usually there for like an hour, like the initial appointment at least, to kind of get to know, like I said, the owner and the pet as well, and just kind of see, their living situation, um, you know, where their food is, all those things. And it does provide more of a personalized, I can customize the treatment plan
Right.
to that pet, to that family a little bit more than I could. It would take me a long time to figure that stuff out just being in an
Right.
exam room with them. So I really enjoy that part of it. And I have a lot of patients that are more like arthritis,
Right.
chronic conditions that need a little bit more, high touch,
Hmm.
and I call it kind of hybrid. So I do work with people kind of, by digital, so text message or
Sure.
video, that kind of thing to kind of make sure we're on the right track and
Yeah.
not necessarily have to be there, but, get to kind of check in and make sure things are okay, going okay.
Yeah, I like that, and that's kind of why I do what I do is because I
Mhm.
want to be able to spend that time with
Yeah.
people. And then, I think the most people I've ever seen one day in a clinic was 26,
Yeah.
but that was horrible. Like they didn't
Yeah.
get good care. I didn't feel good at the end of
I
the
know.
day.
That's
And
exactly how I
so, and then I
feel.
would give all those people my cell phone number then too, because it was my
Yeah.
business. But, and some called, some didn't. Most people don't,
Yeah.
take advantage of that situation. But now, where I'm going to see 5 people in a
Mhm.
day is really what I want my busiest day to look like.
Same.
And so I have, I can spend an hour
Mhm.
or more at that house, and that's only 5 hours of my day. And then I spend the rest of the time driving,
Right.
not doing paperwork because I'm
Yeah.
not fooling with a lot of that, but just spending time with people,
Mhm.
getting to know them personally
Mhm.
and what they need. And so I
Yeah.
love that that's what you're doing.
Yeah. It's about forming a relationship with them.
Yeah.
I said since COVID, like I just feel like veterinarian, it's very hard to, spend that kind of time with people. You just can't because you have other patients, waiting and other clients waiting and you want to be able to give it all, but you just can't.
Yeah, no, absolutely.
But my clients are great and they have my work, number, but they all, they've respected and I don't feel like, like we have boundaries
Yeah,
and they know when I'm
because you're building
available and when
relationships.
yeah, when I'm not. So
Yeah. So hard question, cats or dogs?
oh, I said I enjoy seeing cats a lot more now that I get to see them at home.
Yeah,
And two, they're just so funny. Like they're so like just more interactive. In an exam room, you just like they're on the table and like or
yeah,
they're in the carrier and that's it. But at the home, like you can kind of see like what they do. And so cats, I really do enjoy seeing cats more now that,
that's funny.
I'm in the home with them. Some cats, like I said, I just saw a spicy kitty yesterday. So, but it's called a calm and cozy cat wrap. So it's
Uh,
like a cat snuggie,
oh yeah,
basically. It's not like a swaddle. And I use that for cats that like, don't want to sit there for a vaccine. So I just wrap them up in that. And it has little pockets where you can give them vaccines and it's pretty cool. So I don't have to and I do if I need someone to come help me. I have some vet techs that will come help me just for the
right.
day or whatever. And they're great. But it's surprising, like dogs and cats do surprisingly well, like at home
Sure.
and people I feel like sometimes less is more. And, when they're in the clinic, they're just already like, that there's the car ride and then there's or the carrier that they've been in and then there's all the smells and then it just escalates to the point where these dogs and cats are just so stressed out
Yeah,
and you have to restrain them and they get more stressed out from that and the owner's a little stressed
yeah,
because it's just the veterinary like it's overall and that's just how it is like that's just the nature of it but um I find that, dogs do pretty good at home and
yeah,
let me get blood and,
right.
do that stuff. And I use a lot of treats and cheese.
Right, yeah. I do that with
Um,
my people too. I use cheese and treats.
yeah, like I have these Lickamats, so just put cheese, the squeeze cheese very highly processed cheese and
Yeah.
put that on there, and they do
I
great.
love it. Walk us through a kind of a first visit when you go to
Yes.
someone's house.
Yeah, so typically I set up like an initial consultation. So that's the exam and the in-home visit, the assessment, and kind of make a plan, going forward. I try to get, as much history as I can before the appointment so I can kind of make a plan. And I kind of do that for all my appointments. So I kind of check in like right before I'm like coming in, be like, hey, like, is there anything specific going on? That way I can kind of prepare because I have a house call bag, and then um, I have a lot, like I can do lab work. I can, do ear testing, skin testing. Can't do x-rays, but I can do quite a bit, but as long as I know what I need.
Sure.
So I bring whatever I need with certain medications that I feel like might be necessary. But same thing with an, initial consult, just try to get as much history as possible before, going in there, and then, just meeting them and trying to figure out kind of what, their goals are, what has been working, what hasn't been working, what they can do, what they can't do. So some people can't give medication, some people can, some people are on a just busy schedule and, can't do certain things. Because that's another thing to being in the clinic. It's just you kind of just say, you do this. And then people either are not front with it or don't have time to say, like, I can't, like, I
Right.
can't do those things. Like, I have kids at home, or I have, parents to take care of, or like anything like that, you get a better, I customize it to like what you're able to do.
Yeah.
Because if you aren't able to do it, then, we
Can't
want
do
to
it.
do the best thing for the pet. And then kind of make a plan. Sometimes I will do kind of like a 3-month program for some pets. So like pets that are like arthritis or something like that, where we kind of set up like, okay, we're going to work together for 3 months, and then we'll kind of see from there like what we need to do after that.
Yeah.
Other pets, just they're healthy, they're good.
Yeah.
We just do vaccines and.
Right. With your arthritic pets, do you prescribe any kind of exercise or stretching for them?
Yes.
Okay.
So, I actually have pets that, they do really well with like strengthening exercises. So, even something as simple as like a walk, of course, or just sit to stand, like it helps strengthen their
Yeah.
back legs, and a few other exercises that can be really helpful. I wish people would. I have a hard time getting people to stick to it,
Yeah.
but just because they forget and they
Yeah.
get busy, but it really does make a difference, for their strength.
I love that you said sit to stand because
Yeah,
that is my favorite exercise
yeah,
because, I've seen mostly geriatrics over the years. My business now focuses on people over 40, which I am.
yeah,
But sit to stand, like if somebody
yeah,
can't get off the couch, if your mom can't get off the couch, if
yeah,
you just get one of these chairs and have them sit to
yeah.
stand and just keep on and give them weights or whatever, eventually they're going to be able to stand
Mhm.
up and they're going to be so surprised. I'm like, it's just,
Yeah,
we all sit and we all stand.
yeah.
So same thing
Same
for,
exact for dogs.
I
And
love it.
I tell people it's like a doggy squat because it,
Yeah.
strengthens their back legs and all that. But it's kind of just like in people. So it's kind of, we see a lot in dogs is, they're painful and then they stop moving, and then they're more painful and they stop moving.
Right.
And then you go to the clinic, you get arthritis meds, and, that helps for a little bit, and then it, gets worse. So if you're not addressing the strength part of it, then you kind of really miss out, on really, giving these pets a longer and better, quality of life.
Yeah, I think I'm gonna just put that clip on my website
Yeah.
for people because if you don't strengthen, you lose everything. And
Yeah.
I have a bunch of friends all over the country that do canine PT
Yeah.
and
It's
PT.
because
It's crazy.
I'd love to do more. It's just like I
Yeah,
don't quite
like
have time to like
sometimes I
rehab
honestly
and
think
all
like I
that
should
stuff.
just stop treating people and start treating pets because
Yeah.
I think we'll spend way more money on our pets than
Yeah.
ourselves. Yeah.
Yeah. But the rehab, like that's becoming, more commonplace,
Right.
to see, but they have like, the little balls and stuff that
Right.
the dog has to be very treat motivated though, is the
Yeah.
only thing. Like it has to be very food motivated,
Right.
to get them to like do the
Do
things
these things.
that, but there's simple ones just to do at
Sure.
home.
Then I could get my bulldog to do anything because he
There you
wants
go.
food all the
Yeah.
time.
Yeah.
It's ridiculous. He's a glutton.
Yeah.
So who's your favorite to treat? I know cats and dogs.
I said, the older patients, so just to kind of tell a quick story. So I have one patient, his name is Chance. He was kind of one of my first first patients, that when I saw him, like he's a 120-pound dog. He's a lab Pyrenees mix. The owners are a little bit older, like they just have, and he hates going to the vet. Like they're like, we just can't take him. Like
Right.
it's just, he gets too stressed out. He's too big. Like he won't get in the car because he hurts. So I started seeing him last December, and we definitely worked on a few different things. So we talked his weight. That's another big thing that I work on with clients is like, working on how much we're feeding them and like how many treats they're getting, because weight does play a role into it too. So when I first met with him, we started working on his weight. He was also we diagnosed him with hypothyroidism. So his thyroid levels were lower than normal. So we got him on thyroid medication. He did pretty well. And then we started doing these pain injections for him. They're called Librela. And he did really well with that. And it's December now, and he's doing great. Like he's one of my favorite patients just because he's always so happy when I come over. And he is coming to the end of his life. Like I
Sure.
think we're gonna have to like make the decision at some point. Like it's starting to, just kind of wear on him. Like he's having trouble getting up, even
Right.
though, he was doing really well at first. So, but it did give that. So if they wouldn't have had me as an option, to see him, he might not have had that opportunity they
Yeah.
might not have had the opportunity to have another year with him.
Right.
Because they just couldn't take him to the clinic and he wouldn't have been able to get that care.
Yeah, well, that's huge. I mean,
Yeah.
that's. I'm glad you told that story because
Yeah.
I think that's a great example of why you
And
do what you
that's
do.
kind of like but like I said, I love working with cats. But the older senior dogs is kind of my favorite.
Yeah.
To kind of work with because
Right.
you can see quite a bit of improvement. And just giving them a little bit longer of a life to spend with their owners is
Sure.
huge to people.
Yeah, so we have a 15-year-old cat.
Oh wow, yeah.
And my wife had her when we got married,
Yeah.
and then we were never home, and she was bottle fed, so she was spoiled, so she'd pee
Yeah.
on everything.
Oh,
And so we gave her to a lady who had like 2 dogs and 16 kids living with her. I don't know. But she kept the cat, her name's Marley, forever.
yeah.
And then she passed away 2 years ago, and everybody was allergic, so we got Marley back.
Oh,
And
okay.
so Marley's like my wife's some emotional support animal.
Aw.
And then I have a friend who's pregnant who had a giant cat. I don't even know what he is.
Yeah.
He looks like it doesn't matter what he looks like because I can't remember right now. But he's huge and he's fluffy, and now he's
Yeah.
torturing the 15-year-old. And I'm like, okay, you may have to go back somewhere else. But so he's a boy. He comes and lays on my head at night.
Yeah.
Marley is 15. She just wants to be. She loves my daughter's heated blanket.
Yeah.
And I'm
Oh
like, I think
yeah.
we should
Heated
just buy
blankets
her
are
a heated
great.
blanket and let her lay on
Yeah.
it. If I was not afraid it would burn the house down, I would just leave it every day
Yeah.
for her. But we've had to put cats down. We've lost dogs. I grew up with pets all my life. It is so hard.
Mhm.
What do you do to walk people through those
Yeah,
situations?
and that is another part of my practice is in-home euthanasias. So saying goodbye, of course, is never easy. I was talking to someone yesterday, that making the decision is like I feel like the hardest thing. The euthanasia, of course, is hard,
Right.
and then the after, just the grief that comes, after. But being able to, have the pet at home, not having to take them to the vet for, the euthanasia is people, really appreciate
Mhm.
that. And people always ask, is that the hardest part of your job? And like, honestly, if I know that the pet is suffering and, I know it's
Right.
the right time, and then it's a blessing to be there for
Sure.
people and to be able to, give them a peaceful, passing,
Yeah.
because that's our responsibility as, pet owners, is to give them that goodbye and like be able to be with them and, love on them and just,
Yeah.
say goodbye. But yeah, walking through that. So as I made the decision is really hard. Some people, struggle with that. Other times, and it's just something you have to do. But so I schedule, the procedure, and then, I come in and we do a sedation injection first and then let them get sleepy. So they're basically under general anesthesia before we do the euthanasia.
Right.
And then they do the euthanasia, and then just depending on aftercare. So cremation, or if they bury at home,
Right.
that just kind of varies.
Right.
Um, but yeah, I do offer that service
Yeah.
and for patients or patients that I haven't seen before.
Yeah, I think that's a huge service because I mean I know we have a 15-year-old cat. Like she's not gonna
Yeah,
live till I die.
right.
And so eventually we're gonna have to hopefully we can, I don't know, make that choice. I don't know what's easier either way.
I
It's gonna
know.
be miserable either way,
I know.
but
It's really, like I said, making the decision is hard if it's, there's not like a clear cut, okay, it's
yeah,
time.
right.
But, and I can, people kind of walk through that
Yeah,
decision and,
right.
kind of give them some guidance. And there's, like I said, I was having this car, there's no right or wrong
Right.
answer sometimes. Um, and sometimes like husband and wife kind of differ on like
Sure.
what you want to do, but everybody needs to feel kind of comfortable,
Right.
with that decision. And it's hard, but I've walked people through it, many times.
Good.
And I tell people too, like I wouldn't be doing the euthanasia if I didn't think it was the right decision. So that as a veterinarian is something that we walk for people through.
Wonderful. I mean, that's a great service to offer, I think.
Mhm.
But like I said, I don't
Yeah.
want to take our baby anywhere. So, Dr. Berry, thank you so much. Tell us
Thank
how
you.
people can contact you.
Yes, so I have a website, so lakehavenvet.com. I prefer text message. I have my number on there. I prefer text messages because I'm right, like mobile, just kind of running around all day. So reaching out to me by text message is good, and we can schedule a phone call if you'd like to talk on the phone. I have a Facebook page, and I do check messages there as well. Facebook's really good for
Yeah.
business stuff. And then we can kind of get some information and get set up, and go from there.
Wonderful. Thank you so much.
Thank you.
Thanks for listening to Shreveport Bossier Local Lens. Be sure to subscribe, rate, and share the podcast to help us spread the word about the amazing people in our community.